Ashley asked me if I'd write her a song. Some show, her show is cool and it's lots of fun. So get your popcorn ready, everyone. Who will she interview on her show today? The Jonas Brothers or Nick Lachey? It's the Awesome Ashley Show. The Awesome Ashley Show. The Awesome Ashley Show.
Hi, welcome to the Awesome Ashley Show. Today I have a very special guest, Elizabeth Fogg. She's an occupational therapist. Hi, Elizabeth Fogg. How are you?
Hey, Ashley. I'm good. How are you doing?
Good. Thank you for coming in today.
Absolutely.
Can you tell us a little bit about yourself?
Well, I am 37, almost 38 years old. I am an occupational therapist. I went to the University of New England to get my degree, so I have a master's degree. I have been working now, it seems possible. I have worked mostly around the Southern Maine area. I stayed here after college, originally from Northern Vermont, and decided to stay here. Got some good job opportunities. Worked with skilled rehab. Pretty much I still continue work, so kind of, I guess, what people would consider nursing home settings. They don't like to call them really nursing homes anymore.
Or rehabs too.
Yep, or rehabs, yep. So there's different, types of rehabs, but I chose that. I really enjoy working with the elder population, older adults. They're great, they're very knowledgeable.
Sometimes they're cranky though.
Everybody has their days and their moments, absolutely, for sure. But I've really learned over the years how to kind of work a way around it, maybe de-escalate the situation, and it works really well. So I've done that for pretty much all 13 years. I still do that on weekends. I currently work for home health, going to people's homes, doing different rehab facilities, assisted livings, independent living facilities. Also do some patients that are on hospice for just some referrals for education.
Oh, that must be hard to work in hospice.
Yeah, so if a patient is kind of still needing some recommendations of safety or transfers or self-feeding referrals, hospice is it's a whole other ball of wax, which would be another fantastic topic to get on the show for sure. But patient isn't quite ready. We think of hospice like they're going to pass away tomorrow or the next day. Some situations it is, but some people stay on hospice for years. Some people graduate from hospice.
See, I never thought of that because, like you said, you automatically think that, when hospice comes, it's pretty much almost the end. So that's pretty much what my brain thought of.
Yeah, absolutely. And before I learned much about it, and I think that's what it used to be, but they've changed the program a lot. So it enables therapy to still kind of go in and work with a patient and give caregivers education. So I do that currently, but I also did an outpatient brain injury program for over 3 years. That was really eye-opening and certainly challenging at time, but really kept me on my toes and made me kind of think outside the box.
Yeah, because sometimes they can't talk, so you have to have your own language with each client.
Absolutely. So, so as an occupational therapist, we kind of look at the person holistically. So we look at literally head to toe, what your deficits are, how's that going to impact you as a person in your home, in society, in the community, how you get around, literally mentally, physically, socially, we look at it all. A lot of people don't necessarily understand OTs a lot. We're kind of OT, they think, oh, you're the other therapy, because we don't really know what you do.
Well, honestly, I get them confused because PT, OT,
oh yeah.
I always get them confused. I don't know why. You think I know by now because
don't worry. And sometimes we overlap. Believe it or not, we overlap with some physical therapy goals and needs just as much as some speech. We can work on cognitive and self-feeding and speech we partner up with a lot. So
it all goes together. It all
goes together. And I love it every time I usually walk into somebody's house. I'm a nurse. Oh, my nurse is here. I got to go. So I wear many hats in the home. A lot of times the PT's here or the nurse is here, but It's a lot of fun. I enjoy working in the home, but so yeah, we do such a wide variety of things in so many different settings. Just with working in my setting, there's a whole other area of pediatrics that I don't touch upon because that's not kind of where I chose to work.
Now, every time you go into a setting, do you have to prepare yourself because you never know what the situation is?
Yes, absolutely. So, I get information about a patient, the reason that I'm seeing them, or if I go work for any facility per diem wise or anything, there's always notes. Sometimes they'll leave me their plan of care, so kind of follow these goals. This is what we're kind of working on, and I can kind of designate my treatment towards what their goals are. So,
What made you want to become a OT?
good question. Kind of at a young age, I think I decided that I really kind of wanted to do more medical background when I was younger, and I enjoyed the physical aspect of maybe, exercising and staying healthy, and I wanted to take that avenue. My parents are in the medical field, a nurse, a pharmacist, and I knew right off the bat that
So
that
there you
wasn't.
go. It's right there.
It's right there. I just knew that I didn't want to do those jobs.
Yeah.
So I kind of branched out and looked into therapy, physical therapy too. So when I was in high school, I did actually some shadowing in an outpatient rehab facility and just some kind of volunteering. So I wanted to dabble in that. So I actually applied to PTOT programs and got accepted to the OT program at UNE and really kind of learned more about it and was really excited because I felt that it was just a lot more versatile of what I could do as a therapist than that maybe a PT would.
Well, I must say it takes a very special person to work in your field.
Well, thank you. Yeah.
Because you have to be caring and you have to have a good bedside manner and you have to understand where, because each client has a different story.
Absolutely.
So
I enjoy learning about people's stories and really trying to find the connection. And I think that's why I really chose kind of the settings that I do work in, so I am able to kind of work on a connection with that person, build trust with that person so they can trust me as a therapist.
yeah, and then because they have to trust you and be like, okay, so if I fall, will you catch me? Or,
Exactly. Yeah, that is the scary part. That's one of the scarier parts of work in therapy is, that risk of somebody falling, injuring themselves, or
injuring yourself too.
Absolutely.
So you must have to take training on how to lift correctly.
Absolutely, yeah. Transfer training is a big piece. You always want to think safety first too. You always want, if you know a patient might be too heavy for you to lift, maybe getting another person to help you or using a special lift, mechanical lift.
Because you never want to injure yourself.
No, you don't want to injure yourself or the patient.
Yeah, exactly.
Absolutely. We both wouldn't win if that happened. And I tell people, no falling on my watch. It's a lot of paperwork.
Yes. It's a lot of incident report.
Oh my gosh, yes, absolutely. And
so can you tell us the difference between an OT and a PT?
sure, absolutely.
Because a lot of people get that confused. I even get that confused.
Absolutely. So in the physical aspect of PT and OT, I tell people that OT is usually from waist up.
Yeah.
So we like to do, a lot of times people think therapy, you're going to think of like exercise, right?
Yeah.
So in the exercise kind of focus on it, OTs like to work upper body.
Yeah.
PTs like to work your legs, lower body. Not all necessarily. If you went to an outpatient clinic, OTs are mostly hand therapists. I have not got my certification in that. That's a lot of extensive training, hours, and testing. So PTs will work on your upper body if you go to an outpatient. By all means, fantastic. But usually, like in a skilled setting, we'll try to separate the two so some patients will remember. However, OTs like to get down and dirty, and we like to work on your ADLs, which is your activities of daily living.
Yep.
Your bathing, dressing, toileting, all that fun stuff.
All the good stuff.
All the good stuff that people forget that you have to do when you get home. And we also do IADLs, which are instrumental activities of daily living, which are your cooking, cleaning, med management,
so you
all
do
those
that
kind of
too?
extra. Absolutely. That's one of my favorite things to do with patients is
Wow,
cooking, baking.
I didn't think you did that part.
Oh, yeah,
Like,
absolutely.
I just thought you worked on the body, you know?
Yep. Oh, no, because we want to see how you do function in your environment. So that's kind of where I put that piece of, we look head to toe and how you function. So in like a lot of kitchen situations or in bathroom situations.
And you got to make sure they're safe.
Exactly. Safety is number one. So we have like a lot of recommendations. Add this piece of equipment to make you safer, or do this task this way. It's safer for you or easier for you.
What happens if your client doesn't take your recommendation? Do you just... sometimes does that happen?
Well, I would say sometimes more than often it doesn't happen. However, document that you educated the patient. It's clearly everybody's right to refuse. And when I talk to patients about recommendations, I have to literally state, this is strictly a recommendation. This would help you for a reason A, B, and C. And a lot of times, they might not have the insight. Finances could be kind of a tricky, thing for people to get in equipment. Fighting with insurances, to get equipment is sometimes tricky too. So, but yes, it does happen a lot. I used to take it to heart, and now I've learned over the years that
not to take it.
You can't. You're not gonna, meet everybody's goals all the time.
You can only do what you can do.
You can do what you can do. You can do the best that you can do.
Have you ever used a sliding board within your clients?
Absolutely.
Because I must say, for me, that's a pain in the butt.
Absolutely. Do you use one often?
No, I don't use one anymore.
No. They can be very tricky. I do use one, or use many with different patients, absolutely. I like to try to get them, obviously, with the PT away from using that, but sometimes that's the only option at the time.
Yeah, that's the only option.
And thank God for those little pieces of wood that help, or plastic that help you slide over, because it allows a patient to be independent in a transfer when they might not have a person to assist them. So it's really... some people are okay with it, and sometimes they say, this is just a step in your recovery. We're going to use this and then work on getting to the next step.
Yep. Because I had to use one of those when because I got diagnosed with lupus, and I had to learn everything all over again from head to toe. So
it's a big job.
Yeah. So I grant those who can use a sliding board. But for me, they're not. It's not my friend.
No, you know what? I don't think it would be my friend either. We've done a lot of the transfers in school and teaching. We actually will do a transfer to demonstrate to a patient, but it is very tricky. Absolutely.
So I grant those who can learn how to do that, because it's a lot frustration.
Absolutely. So. Some methods might work for you better than they might work for somebody else, and that's where you have to go. Each individual person is going to be a completely different set of goals, techniques that you use, so you kind of have to really, keep your mind going all the time.
Is there different equipment that you bring in when you go see a client, or do you modify them first and then be like, okay, let's try this and see if this works?
Sure. So when I go into homes, some people have equipment that might have been recommended from a previous rehab stay, like their therapist might say, if you go home, this would benefit you. You've been using this equipment here. Sometimes they don't do that. Sometimes skilled therapists will actually go to a home and do a home safety eval before the patient goes home.
Before they come back home.
Yep. So sometimes that'll be done, but 9 times out of 10, I'm in there kind of saying, all right, let's look at your bathroom. Let's look how you get in and out of bed. Let's look at your transfers. This might be easier for you, like a bed rail to get in and out of bed, a shower chair to get in and out of the shower easier, a higher toilet seat.
Or a lower toilet seat, depending on.
Absolutely, higher or lower.
Yep.
Bars on the sides of your toilet, a grab bar on the wall that might make things just a little bit safer. A certain adaptive equipment, one of those handy dandy reacher grabbers.
Yeah, I love that.
Everybody loves those.
I use that every day.
That's amazing. That is amazing.
Mine has a flashlight.
Oh,
and
wow.
It also has, if you drop jewelry.
Magnet?
Yes.
Awesome. I know a lot of them do have them, but the flashlight,
Yeah.
I like that. That is great.
And mine's pink, so.
Of course.
Yes.
Of course. So yeah, using those reachers, a sock aid maybe to help get your socks on or somebody can't bend. So a lot of little tools and toys, toileting tools that can kind of help you become independent in that area. Long-handled sponges to help you independent in the bathroom. Recommend those handheld shower heads so you can.
Oh, I love that too.
You have one of those at home? Yeah, just so it makes it more independent for you to do it, you know?
So then you feel more independent and you don't feel like you have to depend on the person that
Exactly.
takes care of you.
Absolutely, absolutely. And that's really the goal, is getting somebody as independent again, because a lot of times people become very emotional when they lose that independence, and that's really tricky.
What is the best part for you to be an occupational therapist?
I think just the success of seeing people meet their goals, returning back to independence, whether it be a modified independence, what we call, you know, maybe using equipment, or returning back to completely independence, what they were before. Really, it's, you know, a team effort, working with physical therapists, speech therapists, nursing, social workers, kind of making a plan and getting the patient in the best situation, the best physical, functional, mental, social status that they can be, so they can thrive in life and have good quality of life.
And it must be awesome for you to work with a patient, and when you first work with them, to see how far they've come from where they first started when you worked with them. You know what I'm saying? Like,
absolutely.
to see their process.
Leaps and bounds people make, sometimes quickly, and sometimes it takes, you know, a while. But I love seeing it.
How long are you allowed to stay with them? Are you like allowed to?
So in home care, it's right now it's a certification lasts 60 days. So, and then after that, if they have potential to make more gains and are doing really well meeting their goals, I can recertify them for another 60 days. So
Well, that's cool.
I'm going to stay with the patient as long as they need, as long as their goals are being met, and just the good justification for me to stay in. Absolutely. I would never leave anybody high and dry.
Yeah, that would not be good.
The only time things might have happened are insurance driven.
Because insurances can be tough.
Very tough, absolutely. Younger the patient, sometimes the tougher it can be with insurances. But for the most part, you know, we work around that and try to give the patient what they need, or find somebody in the community that can do that.
Okay, so besides you being an occupational therapist, I know you have a family life after, like, so what do you do for fun when you're not?
Oh boy, so when I'm not.
Are you always working, or do you have
Sometimes it feels
days
like
off?
that, of
Yeah.
course. Obviously, weekends off. I know I explained that I do sometimes work per diem on the weekends. Not every weekend. I think before I got married and had a child, I was kind of more of the workaholic. But I've kind of slowed down a little bit. So, you know, enjoy taking weekends off to spend with my husband and daughter. And she being 4 years old keeps me on my toes.
She just turned 4 years old. Right?
Just turned 4 on Sunday, yes. 4 going on 15, I think.
Is she into that whole Frozen?
Yes, she enjoys all the Frozen, any Disney, any new movie
dying
that's
to see the
coming
new
out.
Frozen.
I know, it's coming out
So I need someone to take.
tomorrow, right? Hey, yeah, haven't made any like actual plans yet to go, but she's already gotten a lot of toys for her birthday, the Frozen
cool.
theme. Yeah, she kind of hooks on to whatever's newest movie is out, you know.
Is she excited for Santa?
Yes, she is excited. After the birthday, she wanted to know if Santa was coming tomorrow. I said, pump the brakes. Pump the brakes. You've already got a lot of stuff for your birthday. Mommy needs to think, and Santa needs to think of what to get you for Christmas. She's at the stage where anything that comes on TV, she wants that.
I like the video you posted on Facebook where I think she was trying to be a doctor or something.
Oh,
Or do
yes.
you remember that?
She loves to be Dr. Kit, and I mean, she knows that Mommy works in healthcare,
Yep.
and she has come to some workplaces with me before, so she sees, some of the things I do. So, yep, she likes to be doctor or vet
That's
or
so cute.
dentist.
That's so cute.
Yep, and every day kind of changes what her profession is going to be.
And then I think you said one time that she wanted her own Instagram or something.
Oh my God, yeah, she mentioned something about she was on Instagram. I don't even have Instagram.
It's so funny how like the younger generation already knows about Instagram, and she's only
Oh my gosh,
4
she's
years
just
old.
4. Yes. I asked her, if you ask her what she wants for Christmas, she will say, I want a phone so I can FaceTime. And
Oh,
no, that's not going to
now
happen.
have you ever FaceTimed anybody?
Oh, yes, we FaceTime my family who lives
Okay,
in
so then-
Vermont. So
then she knows what FaceTime
she is, and I said, you have an iPad, you can do that. You don't need a phone. Gosh, put the brakes on. So, I enjoy doing any fun family-filled activity.
And you guys just came back from a vacation, or?
Yeah, my husband had a work conference, and I went to Florida with him, and then in the last month we went on a cruise.
Because I think Stacy did his hair right before you
Yes,
guys left.
yes.
Because that's when I went to go do my
Yes.
to go do my hair.
Yep, either, came back or just left. Yes, yep, we went on a cruise for our 5th anniversary. It was really nice, to Bermuda. It was like
That's
a
awesome.
week after the hurricane hit.
Did Sydney go with you, or did
No, Sydney stayed. Sydney stayed with my mom. It was our first vacation kind of alone since our honeymoon, but she had fun at Mimi's house.
That's cool.
Yep, she enjoys that, so.
Well, thank you so much for coming on the show. I
Absolutely.
really appreciate it. And I wanted to say
Pleasure.
thank you for showing Stacy the new equipment at the hair salon.
Absolutely.
Because it makes my life a lot easier
So glad.
to wash my hair.
Absolutely.
Now I don't have to get out of the chair.
Absolutely. I'm so glad that that's working out
I feel like
for you.
I have to do a workout to get my hair done. So
Yeah, absolutely. I'm
Thank-
glad that worked for you.
thank you so much for coming on. I
You're
really
welcome. Thank you for having me.
appreciate it. And I'm so glad I finally got to meet you
Yes, absolutely.
in person.
Absolutely.
Thank you guys so much. I hope you enjoyed the show.
Ashley asked me if I'd write her a song, so I wrote her a song for her awesome show. Her show is cool and it's lots of fun, so get your popcorn ready, everyone. Who will she interview on her show today? The Jonas Brothers.